Welcome to the Forward Miami Show. I am your host, Damian Pardo. For those of you who don't know what Forward Miami is, it's a local nonprofit, and we work with issues around diversity and inclusion. My guest today is very special guest, Tony Bosch.
Damian, thank you for
Tony
having
the
me.
Notorious.
That's what they say.
Like RBG, but Tony
right.
Bosch.
Yeah,
right?
you can use several adjectives there.
Yeah,
It's okay.
I could.
Choose the best one. The best one that fits this show at this point is fine.
I could. You have a history, right? Quite a history in Miami.
Quite a history.
That whole like baseball scandal, the whole steroid stuff. But first, how did you get to Miami? How did you get to that? You know, how did it all come about?
How did I get to Miami? I think I got here when I was like 11 years old. My parents had graduated from medical school and they were looking for a residency, and they basically they found one here in Miami. Otherwise, I was born in Astoria, Queens, and I was fine over there. And but I had no
you
choice.
were better there.
I think I was better there at that moment. And then they brought me to Miami. And so when I got to Miami, it's like, what is this place? It's
I
like,
think some people are still asking that.
no, it's like, where's Jimmy the ice cream guy? How come I have to be, indoors at 6 o'clock, 5 o'clock in the afternoon? Like, what's going on? We're all like the kids in the neighborhood. There was no neighborhood, So, and I come from a part of Queens, which is, it's apartment buildings, it's the working class.
Yeah.
And so, the kids would all mingle together and talk about a melting pot. That was really a melting pot. Then I got here and which I'm grateful for now, but we moved to Coral Gables, and Coral Gables is like nothing. It's like, it was, we were the token Cubans
Back then.
Yeah. And but I love my Irish. I love my Irish boys. That's what I grew up with.
And how did you get to steroids, medicine, baseball, that whole thing?
I don't do steroids. You got the wrong guy.
Well, not you.
I was accused of
baseball players.
Testosterone. Okay, which is a natural steroidal hormone.
Explain the difference just real quick, like, because most people just think steroid scandal, A-Rod.
Listen,
like, all that.
It was. And I get it. The journalists and everybody involved, they like to call it the steroid scandal. It's easier. People understand that.
It's a soundbite,
right? People understand that better, and it's uglier than saying testosterone, which was my real crime. Right? It's the distribution of testosterone or the off-labeling of testosterone, and so.
And was human growth hormone part of that, or
that was part of that. But again, that's not a steroidal hormone. That's a hormone.
Right.
Right. And then I used a bunch of peptides. 80% of all my protocols were peptide based. And they didn't understand what that was. And that's
your official title, I was surprised, is Biochemist, Biohacker.
Correct.
What does that mean? Like, what is
a biochemist is somebody that understands
the biohacker part.
Oh, you want the biohacker part? Okay. Well, here, I'll explain it like this. The biochemist is the guy who understands the biochemistry of the body, understands biochemical pathways, if you will, right? And understands the interactions of drugs within those pathways and what receptors are activated, if you will, with certain drugs or classification of drugs. Where the biohacking comes in is where you can actually manipulate these drugs, if you will, these substances, in order to trigger certain biochemical reactions whenever you want them and have them do whatever you want them to do. And so you are manipulating the body or these biochemical reactions, or your certain response at a certain time, if you will.
Right.
If that made any sense.
It made
I dumbed it down.
It made complete sense, because in essence, what you were doing back then is kind of helping the body respond more physically for athletes.
Absolutely.
Right. And that also pertains to people with aging, right? Like people who are trying to stay young. People.
Yeah. And you know, at that time, athletes paid better, but that was it, you know. But at the end of the day, this was offered to everyone. You know, I think there's even a book called The Athlete Within. Mm-hmm. And we're all athletes you know, you're an athlete, you know, you're an athlete of your profession, and so on and so forth. You know, maybe I'm an athlete of my profession. And so it's all about human performance. And so if you're a Fortune 500 CEO or executive, your performance is based on cognitive health or focus or clarity, or, you know, how making the right decisions, being clear enough to making the right decisions. So the performance now there is based on neurotransmitters. As an example, you know, the dope. All right. In an athlete, it's recovery. I have to get up every morning and do the same thing over and over and over and over again. And I have to perform physically at this level. Like
the tennis players, like Nadal and Federer and all these people that are really having a hard time staying.
Correct. And so, you know, there are things for the layperson to perform at a certain level, but they forgot the athlete. And so I was the guy that filled the gap. Mm-hmm. You know, I filled a need. Everybody ignored the athlete as far as performance was concerned. And they ignored it two ways. One, these owners really didn't care, number one. And number two, they banned certain substances for these athletes to recover properly. And
let me ask you, weren't these athletes taking a bunch of steroids? I mean, I was almost under the impression that all athletes were taking steroids. I know, like, especially younger guys in general, and especially younger guys in the gay community, do a lot of steroids and a lot of testosterone and a lot of, because obviously everybody wants to look
good.
Everybody wants to look big. It's like a big thing.
Well, not only do you want to look good and you want to look big and you want to look healthy, you know you want to perform also at that level, right?
Yeah.
And so yes, they were, but because of the ignorance, that's why they were doing it, because they were reaching out for help. They were crying for help, but nobody was helping them. It's like, no, you can't do that. Oh no, that's bad for you. Well, what can I do then? Well, no, there's nothing you can do.
But is it bad for you? Is taking steroids bad for you?
Look, and if you don't believe me, you could overdose on water. And if you don't believe me, you could Google that. All right. You could overdose on caffeine. You could overdose on, hell, the worst, you know, one of the worst addictions that we have and one of the worst drugs we have in this country is food.
Yeah.
You know, and I'm not talking about natural food, plant-based food. I'm talking about all the crap that, the big corporations, the food corporations actually create for us. You know, they call it nutritious, right? Or nutrition. But nonetheless, you know, everything could be bad for you in excess. But if you need something, if you need a substance to perform, if depending on what you need, then it could be the best for you. You follow me?
Yeah.
It could definitely be the best. So if there are, you know, if you got bone density issues, then there's some steroidal, substances that are going to be good. If you have let's take menopause for example, right? Mm-hmm. If there's a deficiency in testosterone in women or in estrogen in women, to be precise, estradiol, and there's symptoms behind it, if you could supplement that and optimize those hormones and take away those symptoms, you just, that you create a quality of life.
But how do you know how to do that? Because there isn't like a lot of research on that.
Well, blood doesn't lie. And I always said it, blood doesn't lie. And what I mean about that is you go in there and, like, for example, Damian, if somebody asked me to describe you, if Tommy over there asked me to describe you, hey, what does that? Damian's really looking sharp today, not like me, with his nice tie and, the nice shoes and handkerchief, all groomed up. I look like crap, but it's okay. I'm here. Okay. So I could do that. And in order for me to do the same thing inside of you, blood is the best option. And blood gives me that same clear picture that I have right now of you. It gives me that clear picture of what's going on inside, if you know how to connect the dots. And that's where the biohacking comes in, or even the majority of the biochemistry comes in. Because when you look at your blood work or the blood results, and you see these numbers, and even if they light up like a Christmas tree, how in some of the blood results, it's like red, it's like, oh my God, it's too high, too low, whatever the case is. Even if it is, I'm not only looking at numbers, or the true biohacker or the true biochemist or molecular medicine guy is not really looking at just these numbers, but they're connecting the dots. They're saying, okay, so this is high, but this is okay. Oh, and so that means there's an adrenal deficiency, but there's a negative loop to it. So it's okay that the testosterone, I understand why the testosterone is low. So let's increase it like this, if that made any sense.
Yeah.
In other words, you're able, if you have my information, my knowledge and my experience, you're able to connect the dots and create this puzzle, if you will. And then I could pinpoint.
And you've been doing this for a long time. I mean, you've been doing this, and obviously you must have been good at it if you had these amazing athletes coming back to you.
I think I was pretty good, right?
No, clearly,
you're only as good as your outcomes, right? Because I could bullshit you all, I could BS you all you want.
Yeah, but I'm just thinking out loud. Why you? Like, why aren't more people doing this? Why isn't this more of a thing if it's so on point?
You mean as far as a provider providing this service? Well,
because you're still doing that now, right?
I'm in the educational business, technology business now. I take my science and everything I know, and I put it in a software, by the way.
Oh, okay.
So I could train other physicians that want to get into the space.
And are physicians accepting this?
Absolutely.
Are physicians using this?
Oh, absolutely, because you see it. Because you were talking about the athlete, but you see it in everyday medicine now. So, for example, there is an oncologist that uses, my software, that uses my science, if you will, okay, and he still delivers the same drugs, let's say Neupogen, Epigen, or whatever for cancer drugs, but he's now adding a peptide to it, so the delivery is quicker, faster, and more absorbable. So now you need less of that drug in order to get the same or better effect. So it's really improving medicine today. All these peptides that I've been talking about for years, they called me crazy. Now they call me eccentric, whatever. So now all these formulations, all this science that I've been preaching for years and years and years, now it's okay. Now it's acceptable. Remember, we're like almost 10 years removed from that whole scandal. And prior to that, 15 years prior to that, I was doing this.
And how does that help with aging? How does that help people? Well, I mean, can you help people in their 70s and their 80s? And
so when you talk about aging, you're talking about, the way I look at it is that you can't reverse time. You really can't. I believe what you could do is improve quality of life. So a lot of people are biologically, let's say 70 years old, but physiologically they're 90. In other words, their cellular death is a lot faster than their age. And that's what you could fix. You could take that cellular death, slow it down, regenerate it, and
balance it
out. So now you're 70 biologically, you're 7 physiologically, if you will. Okay, reduce the pathology, in other words, the illnesses. And now you're going to feel like if you're 50, and you're going to probably look like if you're 60. Truth be told, and it's been proven over and over and over again, the human body, tissue-wise, bone-wise, muscle-wise, could live to about 120, 125 years old.
Wow.
And that includes brain also.
In a quality way.
In a quality way. Has it been done? Very seldom. But it's been proven that it can be done. Now, if we can educate the consumer, which is the client, the patient, whatever, and they choose, because look, everybody thinks this is just about, oh, let me shoot this up, let me use this,
They
let me
do.
use HGH, and everything's fine. No. That's part of the piece. But if I could regenerate your cells, wipe out all these disease states, if you will, and then almost like start from over and say, okay, this is the way you got to eat. This is the way you got to sleep. These are the risks that you can take in life. Okay. And re-educate that individual. At the end of the day, the most important the most important thing is food, is life choices that we make. This is not a magic shot that's going to erase all that. Okay. And you could continue living that lifestyle and everything's going to be okay. It's not. It's about, let's take a time out and let's understand that, hey, you're 75. You shouldn't smoke, you shouldn't drink as much. You should get more sleep. You should eat less calories. These are the plant-based foods that you should have. Oh, and by the way, so I can give you an opportunity to for the next 10, 15 years, let me try to regenerate whatever's the cells that are broken, right?
Yeah.
And now let's start again. And let's
gotcha. And what do you what do you tell people, for example, what do you tell those people in Miami who are getting their stuff, whether it's even testosterone or whatever it is, from the street, from an apartment in Kendall? Or
look, I could sit here and be hypocritical and say, no, don't do that. Big pharma is better. Come on. The truth of the matter, you want to laugh? The truth of the matter, everybody gets their stuff from the same place. It's either India or China. End the story.
Really?
Oh yeah. You think CVS?
So you think it's safe then? It's like,
it's safe. What is not
what's the
safe,
difference between the one you have and the one Miguelito has in Kendall?
Well, one, the one I have, you're not going to go to jail. It's FDA approved. There's a prescription behind it, right?
Right.
And the one that Miguelito has, if he gets caught in the car, and he's found with it, and there's not a prescription behind it, and it's from a fake company, now you may have issues. Yeah. But the other danger could be, okay, how is it processed? How is it stored? Et cetera, et cetera. But even more important than that, is not the substance, not the drug, it's not the medication, it's how you use it. And that's where...
What do you mean by that? I mean, if you're just going to go work out, you're living happy, you're just want to get big, you're partying,
Testosterone is good for somebody who's deficient in testosterone and who needs only 50 milligrams a week, as an example. And it's good, testosterone is good for me because I'm going to need 100 milligrams a week for a certain period of time. And we know this because we went through the process. We drew our blood. We understand.
Yeah, but most of these folks aren't drawing anything. I mean, they're just...
Right. So that's where the irresponsibility, that's where the risk lies. And so...
And what's the risk in that?
Well, listen, the risk could be, that's like when I used to have my centers and they were asking me, hey, so are there any side effects? I go, yeah, you could have 0 to death. It's like you can die or nothing can happen and everything else in between, But look, we all know.
But what did you see? What would you have seen? What do you think are the common ones? I mean, I don't think death was very common.
No, but believe it or not, I've seen some emergency situations where the overdose was so bad that they basically the kidneys shut down.
Wow.
And when the kidneys go, the heart goes, and it's over. But nonetheless, the basic ones. It was basically
nonetheless.
you got the hair loss, you got the depression, you got the mood swings, you got the anger issues. So it does affect neurotransmitters. You have it affects the Leydig cells and serotonin. What I mean about that is basically your own natural production of testosterone. So now you depend on this.
Yeah.
No good.
And if you're a young guy and you're out there taking drugs or you're out there taking whatever you're taking, coke or crystal meth or whatever, do those interact? Are they in a worse position?
Of course, absolutely. And actually, the worst drug to take with any of this is alcohol. The one that's
great
No,
point.
yeah.
Great
Alcohol,
point.
alcohol is a war,
And that's the one that most people
and that's the
assume
one
is,
that
is
it's
fine.
FDA approved.
Yeah, exactly. It's FDA approved.
Yeah, it's FDA approved.
That's
Go
crazy.
go
That's a
figure. Go
great
figure.
point.
Go
That's a
figure.
great point.
And
Say that again. So people really get,
yeah, right.
know.
Okay, the worst drug out there is alcohol, especially when you combine it with any type of other medication, be it steroid hormones, be it peptides, hell, be it blood pressure medication, be it a statin for heart, for cholesterol, for diabetes. I mean, alcohol is definitely the worst drug. You can still smoke weed, good, especially good weed, and do this, and actually it enhances the whole thing. But when you come to alcohol, it's scary what the combination can do. So if your listeners, if you ask me, so what do I take out of all this? Listen, if you're going to go ahead and do this, do this the right way and find yourself a provider or a practitioner that.
What kind of practitioner would you go to?
Well, you would have to go to someone that actually knows what they're doing. There's not one set specialist or specialty out there, because you could have, for example, I know OBGYNs or GYNs that practice this type of medicine, and they specialize in female, right? The female functional medicine side of it. And then I know the urologists that practice the male side of it. So you have to do your homework. You have to go out there and find out if they do any type of wellness, any type of functional medicine. That's a correct term, functional medicine, more than anti-aging. Because anti-aging is more, I think, aesthetics, which is important too. But if you're
like
looking
Botox,
at Botox and all that, you want to look good inside and outside,
right.
And so, but find somebody who, and I think the best way, even if you forget that with term functional medicine, you find a doctor who cares and who's going to charge you and not take insurance. That's your guy. That's the guy practicing functional medicine. Yeah.
Because insurance won't cover it?
Insurance won't cover any of this. And it's a shame. And actually, let me take that back. It's not a shame, because I do have a theory. I believe that everybody starts paying their provider, their physicians, directly instead of through a third party payer, I think medicine in this country will change.
Would be better.
Absolutely. But that's another conversation, right?
But quick question though, what do you think is like the price you would be paying if you wanted this kind of treatment or assessment?
It all depends, but
a range.
Maybe a range. I want to say you're going to be spending anywhere between $200 to $400 a month, and and like I would tell my patients of mine back in the day, and today when I do these educational courses for these docs, I get it. I tell them, hey, listen, don't get it twisted. All you're doing is selling sex and vanity. However, the side effect might be you might save somebody's life. And so the truth of the matter, why I say that is, listen, if everybody feels good, looks good, and everything is working properly, you're going to, by default, eliminate the diabetes. You're going to eliminate the hypertension. You're going to eliminate the obesity, the number one killer, right? By the way, since you change your lifestyle, now you're not going to smoke as much or not smoke at all. And now you're going to watch your drinking. You're going to watch your eating, your food intake. You follow?
Yep.
And you feel so good and you're so involved that you're going to pass this down to your children. And it's almost like, and that's how you change. That's how you're going to change the face of medicine here. Not 20 politicians sitting around a table on a bipartisan table and trying to figure out, that's all crock of, what, it's actually, you get guys who actually care about this, and they'll tell you how to change this healthcare system, and I think functional medicine creates a big role. And you're seeing now more. A lot of these doctors are saying, "Listen, I do private pay only, or I do a concierge practice."
Right.
Don't get it wrong. That's functional medicine. They're obligated to provide functional medicine now because it's a concierge practice. Because they're asking you to pay me $500 a year plus whatever. And what do you think they're going to go? They're going to keep you healthy. you know what I mean? So you take it away from the insurance companies.
But they're not doing the blood tests, and they're not adjusting testosterone.
Some of them are, yes.
Really?
Absolutely. Because they're realizing that the underlying condition to all these labeled diseases, diabetes, which is really insulin resistance, you're not producing enough, at the right time. And all these other things like high blood, whatever the case is due to functional medicine numbers, meaning, hey, you have high cholesterol, you have your blood pressure, that comes from metabolic syndrome. That has everything to do with insulin and growth factors and eating correctly and so on and so forth. If you have low testosterone, okay, that affects more than the sex part. It affects your gut health, it affects your cognitive health and your cardiovascular health. And looking through the pandemic, Damian, the pandemic, there was two common denominators in everybody who suffered through severe symptoms if they acquired COVID. And the two common denominators, vitamin D deficiency and testosterone deficiency,
Really?
both male and female. And again, I like to say this all the time. If you don't believe that, Google it.
Wow.
And tell me about if I'm incorrect. So, and I paid attention a lot through the pandemic. It was my job to pay attention, right? Because a lot of things changed, and the way that we approach medicine nowadays changed.
By the way, what would you tell like parents who have kids who are in their late teens or even early teens, and maybe they're already starting on some of this stuff, maybe taking testosterone or maybe off the side, like in Kendall or
don't do it. It's not worth it. I understand if you did it back in the day, it wasn't acceptable now it's more open. It's more acceptable. There are providers that will deal with you.
So parents could take their child to a provider that will
absolutely
work with them with testosterone, and because they want to play football and they want to be big.
Not necessarily. Those are secondary. Yeah, that might be the motivating factor for the teenager, or for the parent, or whatever. But the truth of the matter is, I mean, one of the ways that we go through our growth stages as a child and through puberty is with IGF-1, which is insulin growth factor, which has everything to do with growth hormone. And the other one is through something called the Tanner stages. And the Tanner stages are measured in testosterone. So you got to measure a child's testosterone to know what level or what stage he is in growth. Besides the obvious, besides the bone density, besides the bone growth, besides the X-ray to see the growth plates, all that. Testosterone is part of puberty, big time.
So what would you recommend somebody in their 60s, 70s who has never done any of this? They go to their traditional insurance-based general practitioner and they follow the medical system.
Okay, so if you don't want to change practitioners, force your practitioner to do a real blood test. Not the blood test that...
What do you mean by that? What's a real...
the real blood test is a comprehensive panel blood test of markers of 80 or 90.
So not just a CBC or...
No, everybody does that. A CBC, they do the lipids. They're covering their ass, basically, is what they're doing. They're practicing. They're not practicing medicine. They're practicing Medicare.
Okay.
Yeah, I like to say it like that. They're practicing. Because whatever Medicare says, because I'm scared. Okay, don't be scared. And if you're a patient, don't be cheap with your provider. Don't say you got to put it through my insurance. So now we have to invent diagnosis or no. Go out, spend $300, $400, $500 and do a full panel and see what's going on really. So I'm not saying you have to do anything about it right then and there.
What are some things that you see with that extended panel that you wouldn't catch?
Oh my God, you catch the root cause. If anything, you would catch the root cause.
An example.
All right. So they do the glucose, and all of a sudden there might be a high sugar, and they'll do the hemoglobin A1C, and there might be some insulin resistance that they love to call pre-diabetes. Well, if you go into the growth factors and you do the insulin and you do the insulin growth, the IGF-1 and all these other tests that are not necessarily done, in traditional in a traditional protocol to diagnose diabetes, then you're going to find the root problem of that of that pre-diabetes. Is it because of, is there an underlying condition, such as, is there an immune response situation going on? Is it a food sensitivity situation going on? Is it believe it or not, caused by something called neutrophilia, which is the neutrophils are too high, or whatever the case may be, which are white blood cells. It's like you start connecting the dots, and you'll find the root of the problem. And guess what? You go to the root of the problem, you fix the root of the problem, you teach them how to live, you teach them how to eat, and now you have a healthy adult and could enjoy life, and increase your quality of life.
So let me ask you something, Tony. Where can people get more of your wisdom? If people want to hear more, want a connection here, how do they do it?
Okay, you could actually, I think the best way is through Instagram at this point in time.
How do they find you?
The Real Tony Bosch.
The Real Tony Bosch. That's a great name. The Real Tony Bosch.
There are pretenders, okay? And Tommy knows there's a lot of pretenders, Tommy. And so they're imitators, but there's only one real Tony Bosch. It's the Real Tony Bosch.
Well, I'm glad
you can DM me there, and then I could guide you to the right provider, and the right clinicians, and so you could have a good experience and at least see what is going on with your body at that moment. Okay.
Okay, I'm glad that we got to spend this time.
This is awesome.
Tony. Thank you, the real Tony Bosch. Thank you. And for all of you out there, thanks for joining the Forward Miami show. That's the number 4, WARD Miami, and I will see you next week.